So this is a short topic, that is snake bite. Here, first, which are the common poisonous snakes in India? Okay, you know that it's cobra, krait, Russell's viper, saw-scaled viper. Then sea snakes are there. Okay, mainly studied these. These are the mainly poisonous snakes which are found in India. And next, we should know about the syndromic approach of snake bites. Okay, so when you got an unknown snake bite, it may be neurotoxic only. So it may be a neurotoxicity only, or hematotoxicity, or it may be like local swelling only. Okay, so in case of hematotoxicity, if it is hematotoxicity only, then it may be a Russell's viper or saw-scaled viper. Okay, that is in case of it is a hematotoxicity only case. Okay, so that is in the case of hematotoxicity only case, it may be a Russell's viper or saw-scaled viper. And if it is hematotoxicity plus acute kidney injury is also there, then it will be Russell's viper or humped nose pit viper. Okay, humped nose or pit viper or Russell's viper it may be. That if it is hematotoxicity plus acute kidney injury is also there. And if there is hematotoxicity and also neurotoxicity and also acute kidney is there, acute kidney injury, and plus or minus brown urine is also there, then you should always think about what? Russell's viper. Appa hematotoxicity undengil there should be a suspension of Russell's viper, and if it is Russell's hematotoxicity plus acute kidney injury, then you should add Russell's viper and humped nose pit viper. Okay, then there is only hematotoxicity, just Russell's viper and saw-scaled viper, and these four are there, then it is always Russell's viper only. Okay, so if an unknown snake bite occurs, if these occurs, you should think about this. Okay, next, if it is a local swelling only there, okay, no neurotoxicity, no hematotoxicity, just a local swelling, then think about it as a cobra. Okay, and if there is no local swelling, okay, but bitten when lying in floor, okay, bitten when lying in floor and abdominal pain is there, okay, abdominal pain that will be krait. Okay, so this is the syndromic approach. By looking the symptoms, we can like suspect these will be the poisonous snakes which bite the person. ഇനി നമുക്ക് ക്ലിനിക്കൽ ഫീച്ചേഴ്സ് വെച്ച് കണ്ടുപിടിക്കാം. ക്ലിനിക്കൽ ഫീച്ചേഴ്സിൽ ഇഫ് ഇറ്റ് ഈസ് എ കോബ്ര ബൈറ്റ്, മെയിൻലി ടോസിസ് വിൽ ബി ദർ. ടോസിസ് മീൻസ് drooping of the eyelid. Okay, we can see the drooping of the eyelid if it is a cobra bite. Okay, and in case of viper bite, there will be gum bleeding. Gum bleeding will be present in case of viper bite. Okay, so this is a significant ആയിട്ടുള്ള local reaction. Whenever snake bites here, you will be getting a significant local reactions. Okay, sometimes. So in the key investigations, what all investigation you should do? So first you should do a 20-minute whole blood clotting test. Okay, 20 minute നീണ്ടു നിൽക്കുന്ന ഒരു whole blood clotting test you must do. Here you should collect a 2 ml blood in a new dry glass test tube. Okay, ഒരു പുതിയ ഒരു dry glass test tube 2 ml blood എടുക്കുക. Okay, and leave undisturbed for 20 minutes. Okay, and leave that blood undisturbed for 20 minutes. And if it is a positive test, how we can say it is a positive test? Here the blood is still liquid and unclotted. Okay, while we are looking the blood after 20 minutes also the blood is still liquid and unclotted, then we will say it is a positive test. So this is the 20-minute whole blood clotting test. So that is the first investigation you will be doing. And second, you can do the complete blood counts. Okay, complete blood counts, and if there is hemolysis, then the hemoglobin will be low, and hematocrit, there will be a transient increase in the hematocrit levels. Okay, then if it is a Russell's viper, there will be increased capillary permeability will be there. Increased capillary permeability were there in Russell's viper cases. And in case of vipers, okay, mainly in case of vipers, the platelet count will be very low. Okay, platelet count will be low in case of viper. And you can also identify if there is hemolysis, that is by doing peripheral smear. Okay, hemolysis, in case of hemolysis there will be hemoglobin is low, and also by doing peripheral smear also hemolysis can be found out. And in case of viper, you should do renal function test in case of viper. And okay, next is for checking about the hemostatic condition, you should look for the PT-INR level and also the APTT. And if you get low platelet count, also look for this prothrombin time. If it is elevated prothrombin time, elevated APTT, and low fibrinogen, then think of DIC, okay, disseminated intravascular coagulation. So mainly this platelet is low in case of Viper. And if these three are coming together, okay, that is low platelet, elevated PT, APTT, and low fibrinogen, then think about DAC, okay. And you should also look for serum electrolytes and also look for urine. In urine, mainly dipstick for blood, hemoglobin or myoglobin, okay, dipstick for blood, hemoglobin or myoglobin. And proteinuria നമ്മൾ നോക്കണം, പിന്നെ മൈക്രോസ്കോപ്പി ചെയ്ത് നോക്കണം എന്തിനാ, to detect the erythrocytes and also red cell cast എന്തെങ്കിലും ഉണ്ടോന്ന് അറിയാം. Should do the microscopy of the urine. Then urine myoglobin to detect the rhabdomyolysis, അതായത് യൂറിനിലെ മയോഗ്ലോബിൻ നമ്മൾ നോക്കുന്നത് മെയിൻലി ടു ഡിറ്റക്ട് റാബ്ഡോമയോലൈസിസ് ആണ്. റാബ്ഡോമയോലിസിസ് മെയിൻലി സീൻ ഇൻ കേസ് ഓഫ് സീ സ്നേക്സിന്റെ കേസസിലാണ് റാബ്ഡോമയോലിസിസ് കാരണം. അപ്പോൾ അതുവഴി യൂറിൻ മയോഗ്ലോബിൻ ഉണ്ടോ നമ്മൾ നോക്കണം. ദെൻ ചെസ്റ്റ് എക്സ്റേ മെയിൻലി എന്തിനൊക്കെയാണ്, പൾമണറി എഡിമ ഉണ്ടോ, എന്തെങ്കിലും ഹെമറേജ്, ഫോറിൻ ഫ്രാക്സ്, പ്ലൂറൽ എഫ്യൂഷൻസ് ഓർ സെക്കൻഡറി ബ്രോങ്കോ ന്യൂമോണിയ ലൈക്ക് ദാറ്റ് എന്തെങ്കിലും ഉണ്ടോ എന്ന് അറിയാൻ. ഞാൻ ECG എടുക്കണം, ദാറ്റ് ഈസ് ഫോർ അരിത്മിയ. ദെൻ എക്കോ എടുക്കണം. എക്കോ എന്തിനാണ് എടുക്കുന്നത്, എക്കോ ദാറ്റ് ഈസ് ഫോർ മയോകാർഡിയൽ ഡിസ്ഫങ്ഷൻ. സോ വാട്ട് ഓൾ ഇൻവെസ്റ്റിഗേഷൻസ് യു ഷുഡ് ഡു, ഫസ്റ്റ് നമ്മൾ 20-minute whole blood clotting ടെസ്റ്റ് ചെയ്തു. ദെൻ CBCയിൽ ഹീമോഗ്ലോബിൻ, ഓക്കെ, ഇൻ കേസ് ഓഫ് ഹീമോലൈസിസ് ഹീമോഗ്ലോബിൻ വിൽ ബി ലോ ആൻഡ് ഓൾസോ ത്രൂ പെരിഫറൽ സ്മിയർ ഓൾസോ ഹീമോലൈസിസ് കണ്ടുപിടിക്കാം. ദെൻ the HCT, hematocrit value, there will be a transient increase in hematocrit value, and if it is a Russell's Viper, there is an increase, capillary permeability will be there. And also look for in case of Viper, you should look for the renal function test. Then for hemostatic നോക്കാനായിട്ട് PT-INR and APTT. If it is low platelet count plus elevated PT, APTT and low fibrinogen, think about DIC. Then also look for the serum electrolytes, urine dipstick for blood, hemoglobin, myoglobin, proteinuria. Microscopy ചെയ്യണം for erythrocytes, red cell cast. Chest X-ray എടുക്കണം for pulmonary edema or pleural effusion, അത്, and also ECG and echo. So these are the investigations you should do. Next is the first aid. അപ്പോൾ ഫസ്റ്റ് എയ്ഡിൽ ഫസ്റ്റ് യു ഷുഡ് റീഅഷ്യൂർ ദി വിക്ടിമിനെ റീഅഷ്യൂർ ചെയ്യുക. അതിനുശേഷം ഇമ്മൊബിലൈസ് ചെയ്യുക. വിച്ച് ഈസ് ദ ഇഞ്ചേർഡ് ലിം, യു ഷുഡ് നോട്ട് മൊബിലൈസ് ഇറ്റ്. ഓൾവേസ് ട്രൈ ടു ഇമ്മൊബിലൈസ് ദ ഇഞ്ചേർഡ് ലിം ആൻഡ് ടേക്ക് ടു ദ നിയറസ്റ്റ് ഹോസ്പിറ്റൽ as soon as possible. അപ്പോൾ ഫസ്റ്റ് റീഅഷ്യൂർ ദ വിക്ടിം, ഇമ്മൊബിലൈസ് ദ ഇഞ്ചേർഡ് ലിം ആൻഡ് ടേക്ക് ടു ദ നിയറസ്റ്റ് ഹോസ്പിറ്റൽ as soon as possible. സോ ഇതാണ് നമ്മൾ കൊടുക്കുന്ന ഫസ്റ്റ് എയ്ഡ്. So this one is the immobilization method, that is the Sutherland wrap. You should wrap ചെയ്യണം. നമ്മൾ കണ്ട ആ ഒരു ലിം മൊത്തം റാപ്പ് ചെയ്ത് വെക്കണം ലൈക്ക് ദിസ്. എന്നിട്ട് യു ഷുഡ് പുട്ട് ഒരു റോഡ് കണക്കത്തെ സാധനം യു ഷുഡ് പുട്ട് ഹിയർ ലൈക്ക് ദിസ്, ആൻഡ് അതും വെച്ച് നമ്മൾ റാപ്പ് ചെയ്ത് വെക്കണം. സോ ദിസ് മെത്തേഡ് ഈസ് നോൺ ആസ് ദി Sutherland wrap method. Okay, this is the method of immobilization. So after doing the first aid, you can give the anti-snake venom. Anti-snake venom, അതിൽ immunoglobulin purifies from the serum or plasma of a horse or a sheep that has been immunized with the venom of poisonous snake. Okay, so that means നമ്മളിവിടെ ഒരു ഹോഴ്സ് അല്ലെങ്കിൽ ഒരു ഷീപ്പിനെ എടുത്തിട്ട് we are immunizing the horse and sheep with the venom of the poisonous snakes. Okay, after that we are collecting the immunoglobulins. Okay, we are purifying that immunoglobulins from the serum or the plasma of that particular horse. Okay, that is the first method. And this Indian anti-snake venoms എന്ന് പറയുന്നത് they are polyvalent ആണ്. Okay, they can be used against the Russell's Viper, saw-scaled vipers, cobra and the crane. Okay, and how it is given means the anti-snake venom is diluted with 250 to 500 ml of normal saline or with 5% dextrose. Okay, so first you should dilute with this or the 5% dextrose, and then it is infused over 1 hour. Okay, it is infused to the person over 1 hour. Okay, and main indications for this anti-venom treatment are if there is systemic envenomation or local envenomation. In these two conditions, we will be giving this anti-venom treatment. So ഇനി നമുക്ക് how we can say that here there is systemic envenomation occurs. ഇവിടെ systemic envenomation occur ചെയ്തത് നമുക്ക് എങ്ങനെ പറയാം, that is there will be hemostatic abnormalities will be there. Mainly there will be hemostatic abnormalities കാണും, and plus there will be hemoglobinuria അല്ലെങ്കിൽ myoglobinuria. Okay, so hemostatic abnormalities means here is spontaneous systemic bleeding distant from the bite site. എവിടെയാണോ പാമ്പിന്റെ കടി കിട്ടിയത് അതിന് ഡിസ്റ്റന്റ് ആയിട്ട് there is a spontaneous ആയിട്ട് systemic bleeding ഉണ്ടായിരുന്നു, and there is also evidences of coagulopathies. Here I said no, the first investigation was 20 20-minute whole blood clotting time. So here we had done that, and that test was positive because here the blood is non-clotting. And he also done the other laboratory test, and here also it was all positive that he had done INR. Okay, the PT INR was greater than 1.3, and also the patient's prothrombin time was greater than 4 seconds. Okay, so all the values are longer than the laboratory control values. Okay, so it indicates there is coagulopathy. So first there is spontaneous systemic bleeding distance from the bite site, and there was coagulopathy. And also when we look the platelet counts, the thrombocytopenia was there, that is the count was less than 1 lakh per mm's. Okay, so these are the first 3 findings, and other than this there were neurotoxic signs, cardiovascular abnormalities, and acute kidney injury were there. So how we said that there were neurotoxic signs like ptosis, external ophthalmoplegia, paralysis. Okay, these were the neurotoxic signs. And cardiovascular abnormalities, there were hypotension, shock, cardiac arrhythmias, and abnormal ECG also we got. Okay, abnormal ECG, cardiac arrhythmia, shock, and hypotension. And how acute injury occurs, there was oliguria, anuria. Okay, rising blood creatinine and urea level. Okay, and also oliguria and anuria. So these were the acute kidney injury signs. Okay, these all were there. So there are his hemostatic abnormalities were there. And plus, while we look the urine, in case urine dipstick, there was dark brown urine. Okay, that denotes hemoglobinuria. And other evidences of intravascular hemolysis or generalized rhabdomyolysis also there, that myoglobinuria was also present. Okay, that is myoglobin in urine, that denotes rhabdomyolysis. Okay, that is mainly seen in case of sea snake venom. Okay, and generalized rattler muscle ache, pain, tenderness, pain on passive stretching. So okay, so while these all were present, then we can say that is a systemic envenomation. And next, what are the things that happen in local envenomation? Next, local envenomation. How we say there is local envenomation? So here there was a local swelling first, and this local swelling was involving more than half of the bitten limb. So which was the bitten limb? This was it. That swelling was involving more than half of that bitten limb. Okay. അത് എപ്പോഴായിരുന്നു? ഇൻ ദി ആബ്സെൻസ് ഓഫ് എ ടോർണിക്കറ്റ്. ടോർണിക്കറ്റ് ഒന്നും കെട്ടിയിട്ടില്ല, ബട്ട് വിത്തിൻ 48 hours of the bite. Okay, within 48 hours of the bite, this swelling was spreading. Okay, mainly this bite was on the digits, like toes, especially in the fingers the bites gotten. But within 48 hours of the bites on these digits, the swelling was spreading. Okay, this local swelling was spreading and involving more than half of the bitten limb. Okay, in the absence of a tourniquet. Okay, so that was the first thing you should remember. And second is rapid extension of the swelling. For example, beyond the wrist or ankle within a few hours of bites on hands or feet. Okay, that only I said on the upper statement also, there is rapid extension. Okay, gradually rapid extension of the swelling. Okay, if there was a bite on the hand or a feet, this swelling was rapidly extending. Okay, that was swelling was rapidly extending beyond the wrist or the ankle within a few hours of bites on the hands or feet. Okay, and development of an enlarged tender lymph node draining the bitten limb. Okay, so for draining that particular bitten limb, there an enlarged tender lymph node was also developed there. Okay, so first the local swelling involving more than half of the bitten limb, and that that is occur within 48 hours of the bite. And rapid extension of the swelling, okay, that occurs within a few hours of bite, or development of enlarged tender lymph node, enlarged ആയിട്ടുള്ള tender lymph nodes form ചെയ്തു, that is mainly for draining the bitten limbs. Okay, so these are occurring, then we can say there is a local envenomation. Locally എന്ത് സംഭവിക്കുന്നുണ്ട്? envenomation സംഭവിക്കുന്നുണ്ടെന്ന്. Okay, so next we are going to study about the dose of this anti-snake venom. Okay, so if there is only local envenomation within 48 hours, okay, the first is if there is only local envenomation within 48 hours, then what will be the dose? You should give 5 to 10 vials of anti-snake venom. Okay, you should give 5 to 10 vials of anti-snake venom. And still if the swelling is progressing, you should repeat that 5 to 10 vials of anti-snake venom. Okay, so that's the first